Okay, so there's 7 different fetal heart rate patterns that we want to be able to recognize to know what kind of interventions we have to do. We have the accelerations, and causes and complications from this could be a healthy fetal or placental exchange, intact fetal central nervous system response to movement. So mom's moving around, or doctor could be doing a vaginal exam, or even fundal pressure. So here you can see the accelerations on the fetal heart rate monitor. Mom is contracting down here, and baby's just having typical accelerations and peaks that kind of flow along with mom's contractions. And interventions for that would be reassuring the patient, and there's really no interventions other than that because it's kind of something normal that we would see. Fetal bradycardia. Causes and complications are uteroplacental insufficiency, umbilical cord prolapse, maternal hypotension, maternal hypoglycemia, prolonged umbilical cord compression, fetal congenital heart block, and anesthetic medications. A normal baby's heart rate is 100 to 160, and you can see here the baby drops 80 down to 60, and right along with mom's contractions. Interventions for that is going to be to discontinue the Pitocin, help the mom to a side-lying position, administer oxygen, assist with the start of an IV, monitor the administration of a tocolytic medication if prescribed, and you want to notify the provider. And then we have fetal tachycardia. Causes and complications with this are maternal infection, fetal anemia, fetal heart failure, fetal cardiac dysrhythmias, maternal use of cocaine or meth, and maternal dehydration. And you can see here that the baby's heartbeat is going 180. It's crazy, it's all over the place, and mom's contracting, and there's no correlation. The baby just seems to be in distress. Interventions with that are if a fever exists, you want to administer antibiotics or antibiotics as prescribed, administer oxygen, and monitor the administration of an IV bolus if required. And then there's the decreased loss of fetal heart rate variability. Causes and complications are medications that depress the central nervous system, fetal hypoxia, fetal sleep cycle could be off, congenital abnormalities, and you can see here this is a moderate variability going from as little as 6 to 25 beats per minute. It's not very fast, but it's all over the place, and you can see all the different variabilities with it as far as the rate. Interventions with that are stimulating the fetal scalp to try to get that baby moving, get the heart rate to go up a little bit, assist the provider with application of scalp electrode that gives us a more accurate reading of the heart of the baby, and positioning the client to a left lateral position. Early decelerations. Causes and complications are compression of the fetal head from contraction, so the baby's down in the canal, mom's contracting, and the baby's head gets squished and compressed. A vaginal exam and fundal pressure. And you can see the early decelerations here. As mom's contracting, right before them, the baby starts to drop right along with the contraction right before over here again. It's not dropping too much, so that's pretty good for us. Interventions with that, there really isn't, because as you can see there's no significant change in the heart rate. And late decelerations of the fetal heart rate. Causes and complications are uteroplacental insufficiency, causing a decrease in oxygenation, so the baby is not getting enough. Maternal hypotension, abruptio placentae, so the placenta rips away from the uterine wall. And hyperstimulation, such as your Pitocin or oxytocin. You can see the late decelerations. Mom contracts, baby's heart rate drops. Mom contracts, and after the heart rate drops. Interventions with this are placing the client to a side-lying position, assist with the start of an IV, stop the Pitocin, administer oxygen, notify the provider, and prepare for an assisted vaginal birth or a cesarean birth. And then the last one would be the variable decelerations of the fetal heart rate. Causes and complications being umbilical cord compression, so the baby can be laying on it, short or prolapsed cord, and sometimes too with the compression, just when the water is no longer in there, it's not floating anymore and it's resting on something. A nuchal cord or oligohydramnios. And you can see the variable decelerations. As mom contracts, the baby really drops down, along with the contractions, a lot more than we would like to see. And the interventions for this are changing the client's position from side to side, discontinuing the Pitocin, administer the oxygen, perform or assist with a vaginal examination, and assist with an amnio infusion to put fluid back in there to try to get that cord to float again. And those are all of our fetal heart rates.
Okay, thank you, Janine, for going through all of the fetal heart rates that a nurse might come across.